There's a warning this evening about the spread of a contagious condition.
Minnesota is seeing the highest number of whooping cough cases in 8 years. The state health department reports that more than 1,000 cases of the respiratory infection so far this year. There were only 61 last year. And Health Watch this evening, our Jason Rantala shows us what's behind the spike and the warning signs to look out for.
I was a little surprised to see this year, yeah.
Of the more than 1,000 cases of whooping cough this year, the latest numbers from the Minnesota Department of Health show the vast majority, about 37%, are in Hennepin County. Meanwhile, the University of Minnesota has fewer than 10 reported cases. This week, the university sent a message to students with how to protect themselves.
Every few years, I'd say 6 to 8 years, we do see an uptick in the whooping cough rates, and this happens to be that year.
Dr. Liz Platchek, a medical director and pediatrician with Children's Minnesota, says the illness can begin like a cold virus.
The difference about whooping cough is that cough is going to persist and it's going to worsen.
The only way whooping cough is treated is with antibiotics. If it goes untreated, it can cause pneumonia, infections, and even death. While the whooping cough vaccine is given during childhood, Platchek says adults should be getting a booster every 10 years.
We see it really in people who are a little bit removed from their last dose of that vaccine, that their immunity probably waned a little bit, and so they're more susceptible to getting the infection.
While the majority of cases have been in vaccinated individuals, Victor Cruz, a senior epidemiologist with the Minnesota Department of Health, says the vaccine can still lower symptom length and severity.
The rates of hospitalization in Minnesota are very, very low due to mainly vaccination and also good treatment and identification of cases by healthcare providers.
Platchek says being proactive is key to lowering infection numbers.
Cover your cough, wear your mask, good hand hygiene, back to basics. Washing hands really works.
Jason Rantala, WCCO News.
Dr. Platchek says to reach out to your doctor or a child's pediatrician if you have questions about their vaccination status.